Nutritional recommendations often lag behind scientific evidence, and official guidelines tend to be slow to adapt to new findings. While caution is necessary to ensure safety, it becomes problematic when recommendations outright contradict the available research. This is particularly evident in the case of dietary supplements, especially for aging populations. Beyond vitamin D, the potential benefits of supplements are rarely acknowledged in official guidelines, despite growing evidence suggesting they could play a crucial role in maintaining health and quality of life as we age. As the body ages, its ability to absorb and process nutrients declines. Even with a balanced diet, older adults often struggle to obtain sufficient amounts of key vitamins and minerals. Factors such as reduced appetite, changes in digestion, and medication interactions can contribute to deficiencies. Studies have repeatedly shown that targeted supplementation can support overall health. Yet many health authorities remain hesitant to acknowledge these benefits. The reluctance to update recommendations in line with emerging research leaves many individuals without clear guidance on how to optimize their nutrition as they get older. A prime example is protein intake. Muscle loss, or sarcopenia, is a major concern in aging, leading to frailty, reduced mobility, and an increased risk of falls and fractures. Research indicates that higher protein consumption, potentially supplemented with protein powders or amino acids, can slow muscle deterioration and support physical function. However, official dietary recommendations for protein intake remain conservative, often failing to account for the higher needs of older adults. Individuals who do not consume enough protein through their diet may benefit significantly from supplementation, yet such an approach is rarely encouraged in mainstream dietary advice. Similarly, omega-3 fatty acids, commonly found in fish oil supplements, have been extensively studied for their role in brain health, inflammation reduction, and cardiovascular support. Aging is associated with cognitive decline, and some research suggests that omega-3 supplementation could help maintain cognitive function and even slow the progression of neurodegenerative diseases. While official recommendations emphasize dietary sources like fatty fish, they often overlook the reality that many older adults do not consume sufficient amounts, making supplementation a practical alternative. Another overlooked area is the role of vitamins and minerals in preventing deficiencies that can impact overall well-being. Vitamin B12 absorption decreases with age, yet many guidelines fail to stress the importance of supplementation for those at risk. Magnesium is crucial for muscle and nerve function, and deficiencies have been linked to increased risks of chronic diseases, yet remains underemphasized in standard dietary advice. Collagen, once dismissed as unproven, is now backed by research indicating its benefits for joint health, skin elasticity, and even bone density, yet it is rarely included in official recommendations. Despite these growing insights, the mainstream narrative around supplements often remains overly cautious or dismissive. While skepticism toward unnecessary supplementation is valid, the outright neglect of scientifically supported benefits does a disservice to aging populations seeking to maintain their health. The argument that supplements should only be used to correct severe deficiencies ignores the potential for preventive benefits and improved quality of life. Rather than discouraging supplementation outright, health organizations should provide clearer, evidence-based guidelines on when and how supplements can be beneficial. This includes recognizing the individual needs of older adults, who often require tailored nutritional strategies beyond generic dietary recommendations. Routine screenings for nutrient deficiencies should be encouraged, and healthcare providers should be more proactive in discussing supplementation as part of a comprehensive approach to aging well. The conversation around supplements should shift from a reactive stance to a more proactive and personalized approach. Scientific evidence supports the strategic use of certain supplements to enhance health, prevent age-related decline, and support longevity. Ignoring these findings in favor of outdated guidelines does not serve the best interests of those who stand to benefit. The goal should not be to promote unnecessary supplementation, but to ensure that those who need it receive the right information and support. With a growing aging population, it is more important than ever to bridge the gap between research and policy. Supplements should not be dismissed as a niche interest or a last resort, but rather recognized as valuable tools in maintaining health and independence in later life. Proper education and updated recommendations can empower individuals to make informed choices, ultimately leading to better long-term health outcomes. The science is advancing. It's time for official guidelines to catch up.